Welcome, everybody, to the PCC Institute for Health Professionals podcast. My name is Pete Wright, and I am here with Alicia Dickenson. Alicia, thank you so much for joining us today.
Thank you for having me.
Now, Alicia, you are an instructor with the Institute for Health Professionals, and you teach a class called PICC Care and Maintenance. In addition to your work as a professional educator in vascular access, do I have that right?
That's correct. Yes.
It sounds like you're everywhere doing this stuff, and I'm really excited to hear what this is all about. Even though I have a paralyzing fear of needles, I feel like you're going to walk me through it.
I'm going to poke you at the end.
Yeah.
Too.
No. Yeah. Tell us first what is the PICC and what is the role of the PICC in the sort of bedside care process?
So a PICC stands for peripherally inserted central catheter, and basically what that means is it's an IV that we place typically in your arm. It's a longer IV. It goes into one of the larger vessels in your chest. And that is, one of the benefits of that is you can keep it in longer. So people go home with these catheters and can keep them in for months at a time, and still get their medicines that they need, but then they can actually be in the home care setting. So it allows them to discharge and be out and about.
And that's for patients who need a more regular doses of medication. I assume it's preventing that sort of trauma of continuing to place a smaller catheter.
Exactly. When we place PICCs, that hopefully is the last line that the patient needs for the therapy that they're getting. So maybe it's antibiotics or maybe a weekly medication for a different reason, but it allows them to just have that one line until they're finished with their therapy, and then they can have it taken out, not be poked multiple times, basically. Okay. It helps save their veins also.
Save the veins. That sounds like we need a poster.
Exactly.
At least a bumper sticker. How it's such an interesting specialty. How did you get into this area in terms of your teaching and exploration of PICC access and this vascular access?
I actually was originally working on a nursing floor at a hospital that had a combination of orthopedic patients and oncology patients. And it was before we had a real specialty in vascular access. And so we would just get random patients that kind of needed extra IV therapy that didn't have a place to go. And so on my floor. And so I just got really intrigued by it. And so that was as the specialty was really developing. That was about 11 years ago. And so it was just getting more and more well known. And as I started delving into it, got very excited. So, and it's really grown into a true specialized area of nursing where at this point, we're completely evidence-based. We have new standards that we're using, and it's very exciting. So we know a lot more now of what we do to patients' vessels. And so we're able to assist with that and prevent damage.
Well, I think that's a fascinating angle, and I wonder if you could share some thoughts on how you approach the whole PICC placement and care, both from a nursing perspective and then in particular from a patient perspective. What do you work with nurses on helping to condition patients to expect? Is that something you deal with in the class, for example?
Yeah. And just like you had said earlier, you don't like needles. Nobody likes needles. So they don't like to be poked anyways. And so knowing it's going to happen, if you have someone that's skilled and confident and really knows all of the ins and outs, meaning helps the patient feel comfortable, giving them the most education that they need, but not too much to make them nervous prior to the placement and kind of putting them at ease. That's a big focus of what I do and what I teach the nurses in my class to do, or at the bedside, wherever I'm at, really making sure they have everything they need to have the placement go smoothly. And honestly, the bulk of it is your assessment skills, not, the task itself is important, but knowing what you're looking for, how to assess the patient, whether that be true lab values or what does the patient need? Do they need more information from me? Things like that. So, and really having an idea of what the specialty involves so that you can give the patient everything they need to feel comfortable.
It sounds like as we, talk about regularly on this show, it sounds like so much of the skill involved is, insofar as it's a practical skill, it is very, very much a social skill and a relational skill.
Yeah, absolutely. And that's any area of nursing, but definitely related to IV access. Nobody wants to be poked. And that's what most people remember when they leave the hospital, no matter what horrible surgery they had, they remember they got poked multiple times. So the more that we can do to lessen that, I think the better off we are for patient care and patient satisfaction for sure.
So who is this class geared for? Are we talking about specifically floor nurses, or kind of what's the scope of your audience?
So this class is geared for the floor nurse that may come into contact with a central line at any time in the care that they're giving to their patient, not a specific specialty nurse. So even if you are giving a medication through any type of central line, not just PICCs, this class will also give you the tools that you need to access and care for any type of central line. So it is more general. We do go into specific concepts of vascular access, but you do not need to be in that specialty to be gaining benefit from this class.
Can you give me a high level sort of bullet point overview of the types of things you cover in this class for those who are interested?
Sure. So what we go through is basic care and maintenance of PICCs and central lines, and that includes flushing the catheter, doing blood draws, doing dressing changes, any type of troubleshooting that you might run into and reasons that you need to know those pieces. Everything we talk about also in this class is based on current standards and guidelines with a very strict focus on evidence-based care. It is combined lecture and hands-on, so there is time to actually touch different types of central catheters and access them and do dressing changes simulated.
Simulated. That seems like an important word.
Yeah. We will not be poking each other.
You're not doing this on each other, right?
Not this time.
There are limits. There are limits.
Yes, exactly.
Yes. Okay. So you've talked a lot about or you've mentioned a couple of times that this is an evidence-based class, that the discipline is growing. What is the overall benefit to taking this course? Is there any sort of certification path, or is this are we simply talking about beefing up your core skills?
Yeah, primarily it gives you just a better understanding of what the different types of central lines there are out there, so when you're in that clinical setting, knowing what I have, how do I care for it? How do I maintain it? What are my, risks and benefits that I have for having this catheter, and how do I maintain it? Basically, it's definitely geared to increase your comfort level in caring for these lines, because it can be, it's a nerve-wracking thing if you're not familiar with it, not comfortable with this process. So helping comfort level. It's also a time to network with other professionals that maybe are interested in getting more into vascular access, or just other nurses in other hospitals that you might see what they do for care, different things like that. We do focus a lot, like I said, on current standards and guidelines. So in that, I also talk about organizations that you can become involved with locally and nationally related to vascular access. One of them locally is Infusion Nurse Society. I'm the presidential advisor for that. So we go into that a lot, and it just helps network with other nurses and kind of see what the care is going on community-based.
Well, that was my next question. Where can we find some other resources about the community? I'll go ahead and add that Infusion Nurse Society, Nurses Society, into our show notes here if you think that's a good resource.
I do, actually, and like I said, we do talk a lot about that. They do have a national organization, and then our chapter locally is very active. We have monthly educational meetings at different venues with a dinner involved, and then we have a 2-day conference that's 2 full days of lecture, and it's just great information, but then the networking piece is really invaluable.
What other classes do you teach in and around vascular access? I
actually teach a 2-day PICC insertion class, which also has an ultrasound component added to that. So that's 2 full days of I break it up about half and half of didactic and hands-on. So we do have an opportunity to do a simulated PICC insertion, including the ultrasound component that we use as well.
Okay, so you've got a pair of classes here at the Institute for Health Professionals that you teach around PICC care and maintenance and insertion, and it sounds like you are kept very busy.
Yes, I am. And that's a good thing.
That is a very good thing. Well,
Definitely.
Alicia Dickenson, thank you so much for joining us here on the show today. We certainly appreciate your time and expertise. And thank you, everybody, for listening to us. You can find us on Facebook at facebook.com/PCC Health Professionals, which has become a terrific resource for health and healthcare news, thanks to the contributions of the IHP team every single day. If you're listening to the show on Facebook, make sure you head over to iTunes and subscribe to us for free to ensure you get each and every episode of health professional goodness, just like this episode with Alicia, delivered to your computer or mobile as we post each Tuesday. On behalf of Alicia Dickenson, I'm Pete Wright, and we'll catch you next week on the PCC Institute for Health Professionals podcast.